the first diagnosis was scary, and it was like being hit in the face.
It was 5 months of hell.
No one thinks about turning 40 or turning 30, 20 and not having this incurable illness.
I developed high blood pressure in the course of that. I couldn't eat many times. I was depressed.
And I think it was really hard. We don't know. All we know is that it's going to get worse with time.
Sometimes it was hard for me, but mostly in my mind.
So it knocked me for 6 for probably about a year, I think.
Low all the time. Even right now, I'm sitting here talking to you. I mean, even now, if I won a lottery, I'm not saying, wow, it's amazing. Inside me, I feel empty. Emptiness is all the time.
Now, I'm really proud that over my time in the industry, we've gone from talking about the pill to talking around the pill to talking about the entire patient treatment journey. And we as an agency, we know that we need to build relationships and build partnerships with a number of different stakeholders and change their behaviours. Primary care practitioners, specialists, surgeons, hospital managers, nurses, pharmacists, even payers. And of course, central to all of that, central to that journey is the patient themselves. But it's not just the patient who's online looking at symptoms, looking at possible treatments. It's not just the patient who's in the consultation when that critical information has been delivered and those key decisions have been made. In the hospital ward, there's someone holding the patient's hand. It's the husband, it's the wife, it's the brother, the sister, the mother, the father. All those voices you've just heard, that anxiety, that stress, that despair, but also that fight, that determination, that grit. It's not the voice of patients, it's the voice of carers. Today, we'd like to introduce our latest white paper, In Search of the Invisible Army, the Caregiver's Story. A carer is described as somebody who provides unpaid care by looking after an ill, an older or disabled family member, friend or partner. It could be a few hours a week, it could be round the clock, it could be in their own home, or it could be down the motorway. The reality of the situation is that actually carers do so much more than that. And what I'd like to discuss over the next 30 minutes is their true impact. For the healthcare systems, they are an unpaid army that glues everything together. For our clients, for pharma, they are the potential catalysts to treatment success. To doctors, they're a partner in executing treatment plans. And to patients, they're everything else. Now, during our research, we met with a lady called Sue, who's an incredible woman. Sue looks after her husband. He suffers with dementia. He's blind and he's also immobile. And one of the things that we asked Sue to do was describe her average kind of day. So I'm just going to talk you through it to give you an insight into the life of a carer. She wakes up at the crack of dawn. The first thing she does is make her and her husband a cup of tea. She makes him a snack and she prepares his medication. She then wakes her husband, she feeds him medication, she gives him his cup of tea, she gives him the snack. She also at this point has to do physio on his legs. It's still just 7 o'clock in the morning. Fast forward to 7:30 and a support worker arrives. Working with a support worker, they both work to get her husband out of his bed and into the specially made shower room. They then shower him, they dress him, they do his hair, they clean his teeth, and they put him back into bed. By about 8:30 is the first opportunity she's got to maybe do a couple of household chores, catch up on some emails, have her own breakfast. She might take the opportunity to start doing and preparing some of the medications for when her husband next wakes up at 11 o'clock. She continues through the morning to try and do a job. She's doing her household chores. She wakes her husband up at 10:30. He then has his breakfast, the next set of medication. She has a little chat with him, and this keeps going. At 12 o'clock, a support worker arrives and relieves her of what's taking place. They have a handover. She then goes to do her normal job, and she comes back at 5 o'clock. This continues all the way through the evening into the night. Even when she's asleep, there is an alarm there to notify her if something takes place. This is day after day, and it's clearly relentless. But there are two key things I'd love you to take away from this. The first is that it's absolutely critical. The second is what an amazing amount of insight Sue must have when it comes to her husband and his condition. I find this absolutely striking. So if we take the UK as an illustration, the cost or the value of public health spending in the UK is a staggering 134 billion. That is nowhere near as staggering as the amount of value associated with unpaid caregivers, which is 132 billion. That is effectively 99% of the cost of the NHS. With the NHS, we have our nurses, our doctors, our specialists, our surgeons, our hospitals, our treatments, and over here we have an army of people like Sue. The scale of this is unbelievable. 3 in 5 people will be a carer. So in this room, 140 people will at some stage of their life be a carer. Those that aren't will most likely need one. Not only is this a significant population, but consider the breadth of expertise and knowledge, from those carers that know almost nothing to those that maybe have a little bit of knowledge. So it's a significant population, and it's a real breadth of skills and knowledge. And they have a real impact on healthcare. So here's a study into COPD, looking at the impact of a carer on a patient. Those patients that did have a carer had better adherence to the medication. They also significantly reduced their smoking. In a second study into chronic kidney disease, we can see that patients with carers outperform those that were without in terms of adhering to a diet and keeping their salt intake lower. In a third study, which was a self-management program, those patients who had the help of a carer were 5 times more likely to complete the program than those without. So they're having a significant impact on health outcomes. And then there are exceptional carers. Has anyone heard of the campaign Fixing Dad? People who worked on the paper definitely have. So Fixing Dad, check it out. It's absolutely amazing. So Jeff suffered with type 2 diabetes. He did because he had, like many people, a lifetime of bad habits, and he was really kind of stuck in his ways. He was also kind of quite ambivalent to his condition, type 2 diabetes, didn't really worry about it, carried on regardless. That is until he was in hospital one day and he sat next to a patient, and this patient's had the foot removed, and he asked him, what happened to your foot? And he explains it's type 2 diabetes. For Jeff, this really brought into focus the severity of his condition. He was sharing this with his 2 sons, Ian and Anthony, and for them, this was a real kind of wake-up call. It was a trigger. They then set about fixing the dad, changing his lifestyle, making him more healthy, and ultimately beating type 2 diabetes. Now, at the start of this program, Jeff weighed 20 stone. He was basically immobile. He had to get around on a crutch. By the end of the program, he was doing 100-mile bike rides. He was hiking across glaciers. He was jumping out of planes. Not only that, but he went from 10 meds to a single med. He says, my family could have resigned me to my ill health. I'm standing here today because they didn't. Now, whether we're talking about Ian and Anthony, the sons of Jeff, when we're talking about Sue looking after her husband in his dementia, whether we're talking about carers helping with compliance, adherence and diary, there is no question that carers are vital to healthcare. So, it's been a really busy 6 months. We've spoken to some fantastic carers, 10, from all around the world. We've also been incredibly fortunate that we've had the time of some absolute experts when it comes to caring. We've also done a phenomenal amount of secondary research, looking at journal articles, reports, case studies, and even books. So we've really put a lot of time and effort into understanding something that largely hasn't been discussed. From everything I've said so far, I'm sure you can imagine that as a carer, it's testing, it's challenging, it's tough. It's also inspirational and it's rewarding. But I think the one consistency that we observed is that it's complicated and it's confusing. It's never straightforward. So with that in mind, from our research, we established 4 key steps on the carer's journey. The first is about finding guidance. And by that, we're talking about recognizing carers as a society and for them as individuals recognizing themselves as a carer. And then it's about providing them with the right information. And then we have finding partners. Most likely their relationship with the patient will change, and we need to support that evolution in their relationship. But secondary, they need to start building relationships with the healthcare professionals so they can work together. Then there's finding strength from an emotional point of view, but also from a physical point of view, so they can perform as a carer. And what we found with caring is that carers can lose themselves in care, but we want to make sure they find themselves in care. So as we work through the steps, first of all, we have finding guidance. Shazia is going to come to the stage in a minute. I'm sure she'll talk about this. For a carer, much like a patient, in a heartbeat, your world can be turned upside down. It's at the point when the carer is probably needed the most. Now, when we talk about patients, speed's important. Recognising symptoms, timely referral, getting them on the right medication. The same is absolutely true with carers. It's about we need to quickly recognise them, we need to quickly inform them, give the right information, because the quicker we support them, the quicker they in turn can make a real difference to patients' lives.
So I was 8 or 9 at the time, and it was just so hard, just being told that she's got this incurable illness. We don't know. All we know is that it's going to get worse with time. We don't know at what sort of scale or how quickly it'll worsen. And it was like when I used to see my friends' parents picking them up from school and they were perfectly fine. And then my mum's left side started shaking. And it was horrible. It was just... Because one day she was fine and it was almost like overnight that this illness just came out of nowhere.
That's the voice of Shazia. She's on the front row. We met her in this process, and she, as I say, she's absolutely amazing. She's going to come on stage with Matt. She's going to answer a few questions. And you might have noticed her in the office as well. She joined the team at the end of Easter, and she's part of the graduate programme. When I met with Shazia, the thing that struck me was frankly how brilliant she was. Her determination, her empathy, and her insight that she had. Now, for Shazia, unfortunately, at the age of just 9, her mum was diagnosed with Parkinson's. She very quickly became the primary carer. She had to cook, she had to clean, she had to look after mum. As her condition changed, she had to help her with the toilet, washing, she had to help her dress. Not only that, but she also had to administer medication. She had to engage with healthcare professionals. She had to work out how to navigate a reasonably complicated system. She had an enormous amount to learn, and she largely had to do it herself. And she's not alone. When we look at the statistic here, 75% of carers feel unprepared. 70 to 80% think they would benefit from more information. I find this slide utterly striking. So, as Emily says, who is the Director of Policy and Public Affairs, Carers UK, it is extraordinary, really, that we ask nurses to go through really important and valuable training, and yet we sometimes ask families to do exactly the same task with no backup and no information. 57% of carers assist in medical tasks. 86% do so without any form of training. Now, as I've already said, the first barrier that needs to be overcome is around identification of carers and recognising just who they are.
Well, we think it's hugely important to be recognised and identified. Our recent research showed that people take too long to recognise themselves and identify themselves as a carer. If they do that, and they do that early, and they get the right information and advice, it can help them to stay and work for longer, it can improve their health and well-being, it can improve the care that they feel that they're providing, and overall it improves everybody's quality of life. So it's hugely important.
Now, there's a few aspects to this. There is a job to do in terms of raising awareness within the general public about the role that carers provide. And clearly there's an education piece around healthcare professionals. But I think one of the biggest barriers that we have in the identification of carers is within themselves. So carers consider themselves to be a parent, a child, a sibling, or a friend. They have their responsibilities as part of that relationship, and actually looking after a loved one is just an extension of that. This can be exaggerated in certain cultures. Later in the presentation, I'm going to introduce you to Lina from Italy. Italy is a very, very family-orientated culture. It is about looking after your own and helping each other out. And that makes it very, very difficult for carers to come forward and recognise what it is they're actually doing and differentiate it from the love that they should be providing to that loved one. When it comes to recognising carers, we think there's 3 stages to this. The first is environmental. And I really hope that this white paper sparks the conversation in our industry and we can support the likes of Carers UK. But I think also as an agency, when we consider the therapy areas we work and we start to think about how we can help and support patients, I think we need to start thinking about the carers within that conversation and what role can we play in supporting them in order to better support the patient. Then there's a gateway moment, and these are the critical moments. This is when the door is open to offer support and to offer help. This might happen in the doctor's waiting room, in the surgery, in the hospital, in the pharmacy. It's the moment we can seize to recognise and identify the carers. And as we know, if we take someone like Shazia with her mum's condition, over time that condition is going to change. So we need to make sure all the way through the process that the carers have been recognised and identified and they're receiving the right support. So what kind of support are they looking for? So again, let's go back to Shazia's story. In the first instance, it's around disease information. So what's happening to her mum? What should she expect at a short term and what's going to happen at a long term? We need to provide that disease information. Then it's like, how do we care for that patient? Not just from a physical point of view, but also from an emotional point of view. And then how do we navigate that system and learn these life skills? And the thing about this is, as I say, it's changing over time. So then Shazia needed to start learning more life skills as her mum's condition deteriorated and helping out in that respect. But the other challenge that you face is that you don't know what you don't know. So we need to think about how we can support them along that journey and anticipate their needs, which is a fantastic opportunity for the likes of cognitive computing. So when we're thinking about finding guidance, it's very simple. It's not about giving people labels, because most of the time they're going to shun them. It's not what they want. It's about identifying them and giving them support fast. The quicker we can do it, the more quickly they can provide effective care for their patient. So now in terms of finding partners, there's 2 aspects to this. One is about supporting them to redefine their relationship with the patient. The second one is about building that partnership with the healthcare professional so they can better support the patient.
She used to be his wife, and now she feels she's his mother. She constantly rebukes Michele for not taking his drugs or not wanting to get dressed, to get washed. So their relationship is like a mother to a child. She feels she's more Michele's mother than Michele's wife.
This isn't Lena actually, it's a translator. But I think one of the things you can take away from it, and it's not uncommon, is this transformation in the relationship. So in this instance, going from being Michele's wife to being more like his mother. So Lena, as I say, she's from Milan. We were introduced to her by Carola, and she looks after her husband, Michele. He was formerly a smoker. He had bronchitis for many years, and 3 years ago he developed COPD. Lena looks after her husband entirely, in every way. In addition, she's responsible for administering the medication, and she also supports him with his oxygen therapy. Michele's quite stubborn, and I think you can hear it in that soundbite that there's a certain degree of strain in their relationship and that perhaps his condition is actually deteriorating. From all of the research, we identified 3 very high-level themes for how these relationships can change and evolve over time. The first, which is the best, is we're closer than ever. So we're in a situation where the patient is incredibly grateful for the support that they're receiving. The carer is taking a huge amount of pride and self-esteem in the role that they're playing. There's a proximity to them, there's a shared ambition, and it makes the relationship much, much closer. The second is that our roles are different now, that they've changed. And I was looking at this commercial in the US that does an infinitely better job than I could ever about describing how a relationship might change. So you can see that roles can change. And then finally, our relationship is worse. So this might come about, as we heard from Lena, in terms of there's an obligation, perhaps there's exhaustion, there's stubbornness, and there's frustration. So we came up with, or observed, two different models for the caring relationship. The first is the mother model, and clearly this is where Lena's at. So she's the active giver of care. She's forcing this care onto her husband. Her needs are clearly secondary, and we can hear from the soundbite that she feels kind of burdened. Michele, her husband, is really passive. He feels like it's his right for this care. He is perhaps disengaged in this process. It's not necessarily an ideal place to be. Also during the research, we spoke to someone called Karen, who is a full-time carer for Yvette. Yvette suffers with chronic pain, arthritis, she has mobility issues, she has anxiety, and she has depression. But speaking to Karen was really inspirational. She talked about how they worked as a team, how they had shared goals, how they had shared responsibilities, how they were really working in this collaborative fashion, which is brilliant. Now, clearly, we're not naive enough to suggest that everyone who operates in the mother model should operate a partner model. I just think it represents an amazing opportunity for us to help provide coaching and support and help to try and just subtly shift some of the people from a mother towards a partner model, even if it's just things like a shared goal, which can make a real difference. I think one of the best examples of this, and I apologise for those people that have heard me talk about Matt before, but it really is the perfect illustration of a patient and a carer working together and seeing the benefits that it can bring. In schizophrenia, one of the biggest challenges around taking your medications, being compliant, being adherent. You've already heard in this presentation that carers can play a real part in driving that compliance. A professor in Germany called Professor Kissling, within his clinic, he absolutely focused on educating both the patient and the carer, making sure that they were together and as a team. He had half the rate of relapse of any other clinic in Germany. We digitised what he did, and then in a clinical trial for 18 months with 173 patients, we reduced the hospital admissions by 58%. Why? Because it was a team effort. We were bringing the patient together with the carer to make a real clinical difference. So this is Sue. Sue's the lady who has that brutal day after day. She looks after her husband who suffers with the dementia, is immobile, and he's also blind. So one of Sue's challenges is actually her relationship with the healthcare professional. And what's sad is if we could bring it together and have them working together, the impact could be far greater. So this is Sue talking about her interactions with healthcare professionals.
I think they were very difficult from getting the diagnosis to getting people to sort of listen to us and know that I had the experience. But to begin with, I think I was just purely seen as, the carer who's maybe making a fuss. And so I felt they weren't really taking on board my experiences. And I felt in some meetings that I have known maybe more than they do. We did get to a crisis point where things were very bad. I felt I had to fight, and I still am fighting for every single thing.
When I went through her day before, I asked you to imagine the insight that she has. And now I'm going, imagine a doctor's knowledge and their expertise combined with her proximity. What an amazing partnership to support patients. Unfortunately, it's not always like that. So when it's good, the relationship between the carer and the healthcare professional, it's great. We can hear Aparna here saying her therapist and family are an extension of our family. But when it's bad, it's very bad. We've got Leanne who describes the consultations as a waste of time. When we looked through all of the research, one of the things that we noticed is that healthcare professionals believe they give a lot more respect and knowledge to carers than carers think they receive. Now, I'm not going to say who's right and wrong, but what I am going to say is clearly there is a disconnect. And it's a shame because there are 3 significant benefits to a strong partnership between the carer and the healthcare professional. And the first is insight to the patient's well-being. Gail says this, I think it's really important that carers' voices and opinions are heard and are sought out. They should be partners in the care of the person that they care for. We have someone like Sue who's so close to her husband day in and day out. She knows about his symptoms, his well-being, and really what is the problem in having that second point of view about how a patient's feeling. Perhaps they can articulate the symptoms better. Perhaps they can offer a second opinion or be challenging of what's taking place. Certainly, it's worth considering. We, as a network, we talk about prosumers, people who are informed, engaged, and expert. This is true of carers and their ability to support the doctor with their ideas and their innovations that can really change outcomes.
So, for example, really struggled with drinks and with thickening drinks. My dad loved a cup of tea, but you try thickening tea, it's a nightmare. But thickening smoothies works brilliantly. And when a person can't swallow very well and their nutritional intake is declining, that is at least one way of getting some fresh fruit into them. When my dad was in hospital, we would actually take bottles of smoothie in for him just because he needed to drink. And the staff had never even thought of that. So when you're devising care plans, when you're thinking about how you're caring for the person, to actually involve that carer expertise because it's absolutely invaluable.
What she's talking about there is really working as an ally with the doctor and supporting them. Next, I want to talk about Anil and his point of view. We as the healthcare professionals, we hardly spend time with them, the patients. We provide our skills, our knowledge and our training, but it is the caregivers that are implementing that knowledge and then we are seeing the changes. I understand this to be that the healthcare professionals, they're the architect. They're putting together this treatment plan, but it's the carers that can help fulfill that treatment plan. We talk about winning the moments that matter. Carers can help winning those battles, making the right decisions, and really changing outcomes. But how do we do this? I think healthcare professionals and pharma as an industry, we need to think about shifting our focus from a patient focus to a care focus, so that we're working as a team, exchanging information, having this shared goal, and making a real difference. Now, at the start of the presentation, I spoke about the sheer number of carers. And I've talked about the vital impact they're going to have in healthcare. It's therefore a no-brainer that the stronger they are, the better they're going to perform and the better they can support the healthcare systems.
I don't feel like doing anything and I feel very depressed. And I just go in my room and shut the door and I want to be on my own, which is unfair for my children, really, because they're the age that they want to communicate with their mum. I used to have so many friends, but because of my situation, I can't go out with them So they keep, calling you, Leanne, would you like to go out? And they say, no, sorry, maybe next time. And you repeat that all the time. Then they say, so I'm on my own now. They, trip apart now. So it's no social life at all. It's horrible.
So Leanne is he's looking after her. She's a full-time carer for a mum who suffers with schizophrenia. Unfortunately, her brother also has schizophrenia. She has 3 children. And what she's talking about, which is really quite sad and worrying, is the fact she's coming home and she's locking herself in a bedroom away from her 3 children. And she's not alone. 57% of carers have lost touch with their friends. 8 in 10 have felt lonely or isolated. It's a really bleak picture, given that they're so vital. We can see Leanne on this side. She's lonely. She described earlier in the presentation HCPs as a waste of time. She has no social life. She said she's got no friends. She doesn't work. We also met, and it's one of my favourite people, second only to Shazia, Floris, who's from the Netherlands. And he's about my age, and his wife unfortunately has MS. He also has a little baby girl. She's had 2 significant attacks, and for the second one, Floris had to take 2 or 3 months off work to look after his daughter and to also look after his wife. But when you speak to him, the positivity is unbelievable. Why? Because he's got a really supporting family. He's got a great relationship with healthcare professionals. He's got a real support network around him. He also talks about his use of social media, and he does post regularly on MS and also looking after his wife. And he could not be more emphatic around the energy that brings to him. Now, of course, this is all from a sort of psychological and subjective point of view, well-being point of view. There's also the physical burden of caring as well.
Yeah, I've been admitted a couple of times and I've taken saline because I've been so dehydrated and so exhausted from so many months of work. So your body just gives up one day and you have.
So that's Aparna. She looks after her daughter. Her daughter suffers with borderline cerebral palsy. She also works full time. She talks about exhaustion, dehydration, back issues. It's really not uncommon for a carer to neglect their own health and prioritise that of a patient. But it also has quite a negative impact. So in the case of Aparna, when she's suffering, it's her daughter that misses vital sessions with the physio. So I think the message is really simple. To help the carer look after the patient, we must help the carer first look after themselves. Now, when we spoke to our research group, and please take this on board, they spoke about how small interventions can actually make a real difference to the carer, whether that's meditation, counselling, exercise, even tools like Nike Plus made a real difference to them. And clearly, the stronger a carer is, the stronger that army is, the stronger our health system will be. So, when it comes to finding me, like I say, you can lose yourself in caring, or what we want to drive is finding yourself in caring. And I think it's interesting to consider the University of Life, something we've all heard about. When it comes to caring, that is incredibly true through what you learn through that process.
Caring for my mom, I think, made me very strong. I didn't know I was a very strong person and I could bear some things. And after caring for my mom, now I noticed a lot of very many strong things that I didn't know and strengths that I didn't know I had. I noticed that I can face challenging situations. I noticed that there's a lot of joy when a sick person gets some love. When you encourage a person who is sick, it makes you feel grateful about everything. So it has made me appreciate life.
So Martha is the final carer that I'm going to introduce you to. She's 50 years of age. She's from Kenya, and she looked after her late mother. Her mother, first of all, suffered with diabetes, then later cancer. She had a stroke, and ultimately she was completely immobile. She was unable to eat, talk, wash, or dress. She was entirely reliant upon Martha. Clearly, for Martha, that's going to be incredibly tough. But what she talks about is the amazing amount of pride she took from that, knowing that she couldn't have done any more for her mother. I love this concept of experts by experience. And then we start to think about the knowledge that a carer develops, that proximity they have to the disease, and the understanding they're going to develop from that. They're living with it day and night. The knowledge they have about our treatments, again, due to that proximity and the ideas that they can provide. The critical view of services. And then also, the patience, the empathy, the inner determination. As I say, and I think I've embarrassed her a lot by now, but through this process we recruited Shazia to come and work as part of the team. If I was developing a patient support program, the one person I want as the first name in my team would be Shazia, to get her point of view and her perspective. She's one of a number of incredible individuals. We heard before from Beth Britton, who innovated around nutrition. She also works with Dementia Care, an NHS and Care Quality Commission. Then there's Nabella Jaffa. She's a computer engineer. Her son suffers with autism. She created an amazing app that allowed her son to communicate and made a real difference to people suffering with autism all over the world. And then there was Kenneth Austin, who created EP Detect. His son suffers with epilepsy. So to make sure his son continued to have independence, the app would recognise the movements, everyday movements and the movements associated with an epileptic fit, so that someone could be alerted and, as I say, he could retain their independence. I really hope that this is a call to action for the broadest possible healthcare industry, so that we don't let carers lose themselves in care, we help them find themselves in it. So we look to leverage their experience and leverage their expertise. I really hope that as an industry, and certainly as an agency, we're going to stop ignoring carers. We're going to recognise that what we need to do is look after everyone and consider everyone's needs. In order to better support outcomes, we need to better support carers. We need to recognise and identify them. Recognise and appreciate the insights and the evidence that they can provide, and look to see how we can leverage their expertise in the delivery of treatment plans and win more moments. How do we do that? We identify and we support with the right information. We make sure they've got strong relationships with their patients and with their healthcare professionals. We make sure that from an emotional and a physical point of view, they have strength and that they find themselves in caring. Ultimately, we need to support a carer's understanding as we would a healthcare professional's, and care for them as we would do a patient.
There is an unseen army. It is one of the biggest in the world. It is the army of carers. They are dedicated, usually unprepared, often undervalued. They accept, they endure, they overcome. They have the utmost patience. They are cleaners, therapists, and transport managers. They are dietitians, financial advisors, and storytellers. They play a vital role in the patient's well-being. They give their all. Not just some days, but every day. The question we are asking is this: who cares about them?